for your awareness. We acknowledge that we're joining you today from Treaty 6 territory. We respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our lives. We are grateful to share these lands and are committed to forging culturally safe relationships. May we learn together, engage with diverse stories and knowledge, and use our individual and collective lives to contribute to reconciliation. Indigenous peoples celebrate the value of family caregiving as an enriching experience for caregivers' lives, care recipients, and the community as a whole. It is in this spirit that we present to you today. Oops, sorry, I'm trying to multitask here. The Caregiver-Centered Care Initiative is a program of applied research and innovation at the University of Alberta Department of Family Medicine, led by Dr. Jasneet Parmar. Dr. Parmar is a care of the elderly physician and has worked in the specialized geriatrics program in Edmonton since 1992. She's a professor in the Department of Family Medicine. I joined the Caregiver-Centered Care team in 2022 as Growth and Partnerships Lead. My background is in healthcare and social innovation, with a lengthy career in nursing, health profession regulation, leadership. Today, we're going to share with you the pivotal role of family caregivers, their significant contributions, and the consequences of caregiving. The role and importance of health, social, and community collaboration to build a better system of support for family caregivers. Whoops. And the benefits of caregiver-centered care education for the healthcare workforce to improve outcomes for patients, caregivers, providers, and the health system. We welcome you to put your questions in the chat for response during the Q&A at the end of the webinar. Now, please join me in welcoming Dr. Parmar.
Thank you all. Really appreciate your presence here and your attention to this, what we believe is a very important issue. Family caregivers today are the largest care workforce. We are just providing you some numbers from Alberta. So you can see we have 10 times more family caregivers providing care compared to us care providers. So it is of no surprise that they are providing huge numbers of unpaid hours in care. It is because they are the ones who are providing 90% of the care, if not over 90% in the community. And even in our congregate facilities, they're providing anywhere from 15 to 30% of care. This unpaid care work, when you look at across the country now, is estimated to be over $97 billion and $11 billion in Alberta. And we have to remind ourselves also, as we review this topic, that caregivers play a critical role in reducing safety incidents and improving patient health outcomes and experiences. Next slide. This is to remind ourselves of all the contributions which can turn into challenges for our family caregivers. Yes, they provide personal care and all kinds of support for day-to-day living. They provide a lot of medical care. Medication management is one major responsibility they've taken on. Besides that, a lot of other medical care, which I'm going to highlight shortly, which also includes making appointments, providing transportation, following recommendations given by healthcare teams and other community-based programs. They're also the ones who are on call 24/7. They're the ones managing crisis. They're the ones providing emotional support to family, to our care recipients, to their family members. And they are the ones who are supporting the out-of-pocket costs, the financial burden of providing care often rests on family caregivers. They do. We may think we are the care managers and care coordinators of patients, resident or client cares, but it is by and large family caregivers were the true navigators, the true care coordinators. And you will, if you've been a family caregiver, you would have seen that happen in your own lives, that while you may have, and I've just recently had this experience, as a family caregiver, I had a very responsive family doctor. I had two very responsive specialists, one very responsive pharmacist, and even a private agency supporting my mother. But it was I who was navigating all these services and making sure my mother got the care she needed, including following the recommendations by all these services, adjusting the meds as needed, providing transportation, giving her information and keeping her posted on what she is expected to do, and of course, providing her emotional support. So what this results often in, yes, it's a set of pipes we've shown you reflecting what caregivers provide, and these pipes can burst at any time. And we do see this over and over again as we ask our family caregivers to do more and more, that the stress, the burden of this care often results in deterioration in the health, both mental, physical, and financial of our caregivers. Next slide, Glenda. As I mentioned before, family caregivers are increasingly doing more nursing and medical tasks. So as we are shifting the care burden onto outside our usual traditional settings and services, for example, caring at home. For example, when we are looking at reducing stays in hospital, day surgeries, interventions that we would have traditionally done in different settings now being done at home, we are expecting family caregivers to pick up those responsibilities. So here is a huge list of, and this is not complete by any means. So, now it's become routine practice, right? To ask family caregivers to manage medications, even injections, deal with wound care, all kinds of wounds and drains, and monitor these, and not just manage them, but also monitor and then report back to the healthcare professionals who then can give further advice, etc. Monitoring respiratory status, checking O2 saturations, adjusting oxygen, acquiring respiratory equipment. I've already mentioned drains and drainage bags, and I wanted to point out responsibility for ostomy bags and catheters, urinary catheters. Yes, also arranging all this medical equipment can be quite burdensome. And they are the ones who assist in acquiring equipment that keeps our patients, our residents, our clients safe, such as walkers and canes and wheelchairs and scooters, etc. And once again, coordinating care. And caregivers who perform medical or nursing tasks are particularly stressed because they're worried about making a mistake. Next slide, Glenda. So once again, rising family caregiver distress is something we need to pay attention to. As you can see over the decades, how this stress is increasing. And it leads to a variety of consequences in family caregivers, which we fail to recognize. They are the hidden patient. So you will see the mental health deteriorating, the physical health deteriorating, their family relationships are deteriorating, increasing financial burden. This stress actually can lead to premature medical problems and premature mortality. And this problem is not going to go away because we have fewer family caregivers, smaller families, women are employed, there's changing family structure. People are living longer. More advances in medicine, better management of chronic conditions, and of course, aging in place. People want to live in their homes as long as possible. And how can we make that happen? So it's not just the medical system, the healthcare system that is shifting care onto the family caregivers. As a society, we are expecting family caregivers to do more for us as we want to live and age in place. Next slide. So a quick video from a family caregiver who's a double duty caregiver. Double duty caregivers are those healthcare providers who, of course, provide care at work. They are providers of care, but also provide caregiving at home.
Our caregiving journey started in 2011 with the onset of a very difficult medical situation with my partner, my husband, and an unexpected journey ahead for the next many, many years. My background has been physiotherapy. My original training was physiotherapy, so certainly familiar with medical background. And then over the past 25 years leading up to his illness, I worked with Stars Air Ambulance. So very familiar with the challenges of an illness or medical situation, but certainly did not anticipate what we would be going through with a life-threatening illness in our family. I also have been involved in caring for an elderly family member as well, with another family member. And certainly that caregiving situation and dynamic brings on different challenges with different circumstances. The positives of caregiving are enormous. You become closer to your loved one in many ways, in ways that you never expected. It's a helping and caring situation. Provides an opportunity to give an example to the younger generation on the challenges that they'll have in the future and set that example. It breeds resourcefulness. Certainly my background and that of other family members helped us pull in those resources, but the resources aren't always there. And sometimes you find yourself very alone. So from a positive perspective, that forces each of us to ask for help, which is very hard to do. I think a lot of us just want to cope on our own. We can manage this. I can handle this. And that's not always the case. Caregivers need to learn to say no. I know I tried to take it on myself and say, I'll handle this. And it's physically impossible to do that. It's isolating. Caregiving is isolating, especially as illness proceeds. And we certainly had the situation where at one point I wasn't really able to leave the house unless I had relief. And that's very difficult. Once family members have exhausted their vacation and their days off and can't lean on friends forever, they have their own lives. How do you find resources? So caregiving tightens your circle. Caregiving puts you in the situation of coming face to face with the fear of loss. And that was certainly our case, is trying to do everything possible to ensure that the best care possible and the best solutions were available. And that was the backdrop to all of this, is trying to make sure that survival was the end result. The other negative is financial. We found ourselves very quickly in a situation where we needed to retire, which was the plan in any event, but certainly expedited. And that puts a different dimension when you're doing your last sort of 5 years of work and realize that it's not going to be there. Our care.
Glenda, and I do want to respond to a couple of comments in chat. And Guy, you're quite right. If we start examining our initiatives, you know, all the various healthcare and social care initiatives that are under play, and if we think about how we budget them, we never ever include the family caregiver contributions in those initiatives. If we were to add them, those budgets would increase exponentially. So we are basically taking the family caregiver contributions for granted. So you're quite right, Guy. And Patsy, yes, social care, providing presence, socialization, engagement is, again, a responsibility family caregivers have taken on to prevent isolation and loneliness amongst our care recipients. So yet another role that we sometimes do not give them enough credit for. While we have all these initiatives that are now being carried out to prevent social isolation, loneliness, we got to keep in our minds that family caregivers are already playing this role. And how can we help support them playing all the roles? It's not that it's going to go away and they're not going to do it. However, how do we help them make it work? And that's why I want to share the results of a study we did. And this is looking at double duty caregivers. This is looking at people who care in the healthcare field and, they work in the healthcare field and care at home. So double duty caregivers. And we found, this was just done a couple of years ago, that only 6% are making it work, because they are the ones who may have low expectations, they have strong supports, they have well-connected, they have set boundaries, and the caregiving interface may not be too large. There's another 30%, they're working to manage, and once again, you can see the reasons our expectations are moderate, supports are starting to diminish, but they're still there. Boundaries are getting somewhat blurred, and the caregiving interface is medium. And then we have 2/3 of our healthcare providers now living on the edge. And think of all other caregivers that work, employed caregivers, right, who work and care, where the expectations are high, the supports are weak, the boundaries are blurred, and the caregiving interface is large. So we've got to think in terms of our care workforce as well, who are caregiving, as to how can we help them make it work? How we reduce expectations of them, provide higher level of support, help set limits, and reduce the extent of caregiving that we are expecting them to provide. Next slide. While we have all this that we have to take into account, what is first and foremost, is why do we in healthcare want to support family caregivers? We have missed what research, what evidence, what expertise and experience in this area is telling us. And that is actually engaging family caregivers is not just about supporting them, right? It's not just about reducing their caregiver stress. It's not just about sustaining care. It's also about improving what we are all about. It's all kinds of outcomes for our patients, residents, and clients, which in turn then helps enhance population health. So it improves not just the caregiver well-being, but also the care recipients' health and well-being. It contributes to healthcare cost savings, and we need to remember that, because it is with the support of family caregivers that we can prevent unnecessary hospitalization and emergency room visits and medical intervention, reduce readmissions and length of hospital stays. So while we have all these initiatives that's looking at that, because we know fiscally we need to do more with less, why aren't we taking this into account, that family caregivers actually contribute to healthcare cost savings? So we look at supporting family caregivers in a meaningful manner, where they are supporting caregiving, but also they're able to have a life. They can maintain their own health, well-being, reduce their stress. That contributes to our healthcare cost savings, of course, enhances experiences of care. So we've already talked about supporting aging in place, enhancing safety, quality, and continuity of care. This is happening because of family caregivers. For us, and I know this for a fact because I'm a healthcare provider, and having meaningful relationship with my family caregivers now is the biggest joy in my work life. It reduces my workload, my stress, and it increases my provider satisfaction. And of course, family caregivers are the ones who are contributing to health equity, because they are the ones who remind us that we've got to make sure we support needs for equity denied populations. Next slide, Glenda. So how are we going to achieve this? So we are advocating for a system change, and we've been working. Some of you who have been working with us recognize this, that we've actually been chipping away at these various levels of change. So certainly we need structural change. You know, this is where we need policies that support family caregivers, practices where we engage family caregivers in a meaningful manner while supporting them, and of course, resources. Then we need a relational change. We got to go back to what we like to call relationship-based care. We've got to be, I know technology and being lean and mean and efficient is important, but we cannot take away from our interactions this relationship-based care, because this relationship with our patients, our clients and residents needs to also be offered to family caregivers. So we need to make relationships with them so that we could then engage them in partnering with them in ways that supports all. And we'll show you through a competency framework where we are looking for transformative change. Yes, we all need to be involved in making this change happen. It's no one person's responsibility, and no one organization can take this on and do it on their own. So while we have community organizations rising to the challenge, we need government support and policies. We need communities that support people who need care. Yes, we need our educators to make sure our trainees are also receiving the education they need in developing the confidence to engage and work with family caregivers. Research is continuing in this area, and health system also has to be a partner in this larger system of care, so that when family caregivers interact with healthcare providers or the healthcare system, they feel supported by them. Next slide. So this is just a snapshot of the work that's been going on under this initiative called Caregiver-Centered Care since 2014. And we have landed on, after much discussion, on certain strategies that we feel would move caregiver-centered care in the right direction. And one of them was educating the healthcare providers and social care providers in a competency-based fashion so that they can develop the comfort and confidence to engage caregivers and to work with them. And this occurred around 2019. Once this competency framework was developed, we then went on with various grants, etc., to develop the various levels of education. And some of you have been involved in developing that education, which has been gradually released over the years and has been taken up by a lot of organizations across the country. Next slide, Glenda. So why education? Because we realized during this journey that the biggest gap in supporting family caregivers now is the lack of care providers to meaningfully engage with them. So while within the community and social sector and within the healthcare sector, we have put in more and more initiatives for our patients, for our residents, for our clients, for our customers, we actually have had no training in how to engage the family caregivers, the very people who are providing most of the care, in a manner that is collaborative, that is respectful, that actually supports the caregivers and allows that relationship to foster so that we can go about the business not only of caring for our care recipients, but also for supporting family caregivers. In most models of healthcare today, caregivers are overused and undersupported. So with that in mind, we validated this caregiver-centered care competency in 2019. I'm sure it'll resonate with you. It has 6 competencies. It starts with recognizing the family caregivers. So it's very important. That's where we got to begin. And we have to facilitate this recognition. We got to communicate with them in a respectful timely manner. We got to partner with them, which just basically means that we need to bring them onto our care team, or we got to join their care team, whichever way you want to look at it. And we do shared decision-making in this partnership. Fostering resilience is about assessing caregiver needs, facilitating that discussion. What do they need? They may or may not be able to verbalize it or identify it, but we facilitate that discussion, and it comes from their lens as to what do they need. And then we help them navigate. It's everybody's responsibility to navigate both the health and the community-based sector to find the resources and supports. And then we got to enhance the culture and context of care. If we don't change our mindset and we don't recognize and respect family caregivers, all this will not, what can I say, come to fruition. Next. So we have now developed over the last 4 years, various levels. So foundational education, we'd like all health and social care providers to take this education 45 minutes to 1 hour long. Everything's aligned with those 6 competencies in that framework. We do also have a COVID module if needed. It can be used to train your staff to engage family caregivers during such outbreaks. We have advanced level education. This is very important for people who spend a lot of time with family caregivers. It could be disciplines, it could be various positions that have been ascribed this responsibility. 6 hours, 1 hour per competency. All this education comes with certification, which can be used for continued professional development. Finally, we have just released, actually it's more than just released, in June, caregiver-centered care, caregiver-centered care champion education. 3 hours. This is for people like you and I and Glenda and Stephanie who want to promote caregiver-centered care, who are champions in themselves. So it gives you the skills to then spread and scale and bring about that culture change that so many of us are looking for. And yes, I see some questions about education. I'll try, if you don't mind, I'll save answering those towards the end of the talk. Glenda, is that all right?
Oh, yes, that's fine.
Okay.
Carry on.
Thank you. So all this education I want to tell you is available on this website. It's out for public good. It's also been moved to lots of other learning LMS systems, learning management systems like the Alberta Health Services, My Learning Link, and Covenant Health Click, and Surge platforms, and many others. And it's free. Next. A little taste of the education for you.
I'll see you on Wednesday, Mrs. Fawcett. Oh, hi, Chad.
Hey, how did Mom do today?
She's getting stronger. We had a good session. We'll have another on Wednesday.
Cool.
Looks like your family's home.
I didn't think it happened. She lifted her stick and I got it in. Chad, I scored a goal.
Good for you, Carly.
Well, run up and tell your mom. I'm sure she'll want to hear all about it. Hi. Are you one of Leanne's nurses?
A PT, physical therapist. My name's Natalie.
Hi, I'm John Fawcett. And you've met Chad over here. And that whirlwind that went rushing past you upstairs is Carly. How's Leanne doing?
Good. Tired, though. She's frustrated that stroke recovery can be so slow.
We're all frustrated with that.
Chad, adjust. We all depended on Leanne. She was always so healthy. The stroke has been like a thunderbolt for our family. It's still pretty new for all of us.
Of course. Recovery isn't just hers, is it? I should get out of your way now. You have your hands full.
Oh, you have no idea. Carly has hockey 3 times a week, and she has skiing lessons on the weekend. Chad's on the swim team, which means early mornings. We're all on different sleep schedules. Leanne needs help eating. She needs help getting from room to room. Mostly, I carry her. I sort through her pills and I pick up the new one at the pharmacy. Chad's given up his bedroom for the rehab equipment. He's sleeping on a couch in the basement now. Carly needs new glasses. The roof is leaking. Car needs repairs. We've lost Leanne's income, and I'm not always able to work from home. We've been to the clinic and the hospital twice each this month. When Leanne's asleep, I worry that she's having another stroke. She gets frustrated with me when I can't understand what she wants. Well, I get upset too. Yesterday I found her in the kitchen crying because she'd forgotten how to make a sandwich. So, can you help with any of that? Well, thanks for all that you can do.
Thank you, Glenda. And yes, this is very timely, this slide, because there's a question on education in chat. So yes, education and training are recognized strategies to bolster evidence-based practice and change the culture and context of care. Yes, we have put in a monumental effort for the last 5 years now, since we validated these core competencies, to now incorporate the various levels. As we've released the various levels, we have promoted its spread and scale across all educational, not just institutions, but also staff orientation. Community organizations like Caregivers Alberta, Alzheimer's Society also have taken this education and are training their staff with it. We have put it into the education of medical students, the foundational education into the curricula of medical students here at the University of Alberta. We are making a case at UFC. Different nursing programs have taken it on in different places. Our OT students, rehab students receive a workshop on it. It's growing, let's put it this way. Staff orientation. Many now streams have put it into staff orientation, but we still got a long ways to go. And what we are saying is we are not going to stop till all health and social care providers receive at least the foundational education, if not the advanced, to meet this need to support family caregivers. So I'm just going to show you a clip on why this is important.
In every passing decade, the quality and availability of healthcare to any ailing citizen has improved. And yet, even with all our ever-advancing knowledge, there remain pockets within the system that demand our attention, calling for positive change in attitudes and behavior. The world of caregiving is in fact one such area yearning for compassionate update.
As a healthcare system, we have a long road ahead. It's not difficult to find family caregivers who tell stories about failed care from the system, or such muddled communications between the family caregiver and the healthcare system that, on occasion, a measure of harm resulted rather than the intended care. We can do better. Not only better, but by partnering with family caregivers, we dramatically improve the quality of care, period.
When I began my career as a physical therapist a couple years ago, I came into the healthcare world thinking I had already learned a great deal. I mean, the schooling, the practice, the details. I felt like I was well prepared for my career. And I was, academically speaking. But then I started working with people, actual caregivers, taking care of their parent, spouse, child, or dear friend. And I ran into a few situations that I couldn't have imagined of when I was a student. I wasn't trained to deal with the staggering concerns of the people surrounding my clients. I didn't understand how much pressure was on the caregivers who lived with my clients, whose care responsibilities were much bigger, much more demanding than I could have expected. I was naive. In a real way, the healthcare system has been naive too.
There was a time early on in my career where I was reluctant to pay too much attention to the family caregivers. I thought they inhibited my work, or they took too much time from my schedule. But now, however, I'm seeing that partnering with the family caregivers, really building a trusting relationship, actually saves time in the long run. Now, I'm more efficient in my care plan when I include the family caregivers as a partner. That's been a valuable lesson.
Honestly, before my wife had her stroke, I wouldn't have given the concept of caretaking much thought. I didn't need to do so. My kids were healthy, busy. Leanne looked after the house, and she worked at a graphic arts company. I had my job too, and that was life. And then, boom, she had a stroke, and I became a caregiver.
I'm gonna give Mom her smoothie.
Nice. Don't forget to pick up Carly at 4:30.
On it.
We're adjusting. We're still adjusting. I'm so very proud of my kids. They've taken this all in stride. Now they're caregivers too, even though they're young. It's like the whole family. It's our mission, our purpose. We get lots of help from the team, and we're grateful for that. It's good to be a part of the team. And we help each other too. It's like life has deepened now. Does that make sense? Well, that's how it feels to me.
Partnership with family caregivers improves quality of care. Better communication, respect for family caregivers, fostering their resilience. All these efforts raise the standard of quality care.
Hey, buddy.
However, our healthcare system at present needs more role models, more leaders conversant with all aspects of caregiving. Expertise in this area is still too contained and rare, while the need for implementation is urgent and enormous. The challenge is yours. You will be responsible for healthcare to come, and thus it is you on whom we depend. You are each and all on an ever-demanding path, and your best work is ahead.
Thank you, Glenda. Both these clips were from our education. Please, I'd really encourage you to take the education if you like what you saw. And of course, please, wherever you work, ask others also to take the education. We all need it. I used to think I was pretty good, having worked with seniors in the care of the elderly domain for 30 years. And I learned by engaging in this journey how much I needed to know so that I could meaningfully engage and work with my family caregivers. And yes, the education is available on Connect Care under my learning link. So if you have any more questions about it, write to me. So moving on with this, often we hear this, and we intentionally put this slide up, that caregivers cost time. And here is a quote from a family caregiver. Essentially, the quote is talking about, I don't take up too much of your time. If you can hear me, you see me, you engage me, answer my questions. I'm the one taking care of my husband who's got multiple medical problems now, has had an amputation, is in a wheelchair. Ask me what my husband needs. And ask me, what concerns may I have while caring for him? And how can I manage the care? Next slide. The education around the caregiver-centered care champions has been intentionally developed so people, and we've had hundreds involved in this journey of last 10 years, who want to be champions, who want to promote a caregiver-centered care culture, who desperately themselves may need the support of health and social care providers, government and society at large. we have developed this education intentionally. So these champions have the skills, they have the knowledge, they have the approaches which can bring about this change. It is a 3-hour set of education, 3 modules, one about inspiring change, the next about leading change, and finally managing change. Next slide. Over to you.
Thanks, Jasneet. When it comes to patient safety and quality of care, recent studies and experience have increasingly shown that when true partnership exists between health, social, and community administrators, providers, patients, and family caregivers, that the quality and safety of healthcare improves, costs decrease, and there's a marked increase in patient and caregiver satisfaction throughout the experience. Exploring attitudes about patient and family involvement in their own health journey and providing opportunities for health, social, and community care providers to build their competence and confidence in partnering with family caregivers can be a meaningful way to spark positive culture change in care delivery. Without sustained and meaningful patient and family caregiver participation, the health and community care systems will fail to respond to the real needs and concerns of those they are intended to serve. Establishing patient and family-centered care requires a long-term commitment, one that involves transforming the culture and context of care together, one step at a time. As Dr. Parmar shared, the caregiver-centered care education provides learners with the opportunity to build their professional competence in areas identified as critical to supporting family caregivers throughout their care journey. All the education has been evaluated based on the Kirkpatrick Barr Health Education Evaluation Framework, which encompasses elements of learners' satisfaction with the education, perceived change in knowledge, skills, and ability when engaging with family caregivers, and providers' behavioral changes in practice. The conclusion that health, social, and community workforce education to provide person-centered care to all family caregivers is an innovative approach to addressing the current inconsistent system of supports for family caregivers. We've published our findings on the foundational and advanced level education, and the link to those publications and the PowerPoint slides for today will be provided following the presentation. As mentioned, the education is available online and offers the learner an asynchronous learning experience. And you can see reflected in this slide that since August of this year, as of August of this year, over 13,000 hours of education have been completed through our website, representing over 8,500 unique individual certificates of completion that were provided. The education is also available through partnered organizations, as Dr. Parmar mentioned, and academic programs, representing an even greater reach in terms of the scale and spread of learner engagement, competence development, and completion of the education. Evaluation results are critically important to validating the impact of any endeavor. And although the quantitative data provides positive validation, it's the self-reflective learner responses like those indicated on this slide that show us that there's been a change in the hearts and minds and practice of providers completing the education, demonstrating a true shift in practice towards a more inclusive and supportive approach to partnering with family caregivers. The learner experience, as noted in these quotes, speaks to the engaging format, the meaningful learning experience, and the resources encompassed throughout the learning content. Sorry. We've shared a lot with you today about the contributions and challenges of family caregiving and why it is critical to health and community care, quality, and family caregiver well-being, that family caregivers are supported and included as allies and partners in care. At some point, almost all of us are going to be a caregiver or a care receiver. We have the opportunity to work together today and change the culture of care for a more inclusive and collaborative health and community care system for the future. We leave you with this call to action and an invitation to join us in leading the way to a brighter future where family caregivers are recognized and supported as partners in care. A future where health, social, and community care providers are educated on, practice, and champion a caregiver-centered care approach. Thank you for your time and attention today, and we welcome your questions.
And Glenda, I can respond to another one that was put in the chat. This initiative, yes, was started within healthcare. And this is because we recognize that we were not doing much in healthcare in supporting family caregivers. This is going back to 2013. And that family caregivers were suffering a lot of stress when they were engaging with healthcare providers and within the healthcare system. They were having real difficulty. They voiced a lot of angst and all kinds of challenges when interacting with healthcare providers. So yes, it did start, but very quickly we recognized how important it was for the health and community sector to collaborate to support family caregivers. And in fact, we now have a grant from Alberta Health. It's called Leading the Way, which is integrating the health and social care sector, the social and community care sector. I use both terms because terms get used interchangeably for social and community, to integrate, to provide a stronger system around family caregivers. So in this journey, we also recognized as more and more partners came on to co-design this education with us, that even within the community sector, there isn't cohesiveness. So family caregivers are having difficulty navigating no matter whichever system of care we develop. So there seemed to be a critical need for not just the health and the community sector to work closely together, but also within the community to work in a more integrated fashion. So this is where, we are looking at integrating. And we have been quite successful in our first phase. We've had almost 44 collaborative partners in Alberta who've raised their hand and they want to commit to action around collaboration and integration. So important, right? That we have warm handoffs, we establish continuity of care, that we actually have relationships with each other so that the caregiver doesn't end up having to be that point person for each of the various organizations supporting them, so on and so forth. So I just wanted to share this ongoing endeavor. Yes. So, yes,
Thank
Jane,
you so much.
go ahead.
I've just shared the website address in the chat where you can access the education, learn more about our initiative, and have your staff engage and learn and earn a certificate along the way. Thank you so much for your questions. I see many of them touch on very similar topic areas, and I think you were about to answer Ginger's, Jasneet. So
yeah, and Glenda, maybe you can, you can also add to that. So yes, we have very intentionally engaged all the education institutions in our initiatives. So within Alberta, UFA, UFC, Grand McEwen, NAIT, Bow Valley College, Norquest, all of them are now engaged with this initiative. Many of them have actually started to put the education into play. Others are considering it, and we are working with them. Glenda, maybe you can speak to what you help achieve with CLPNA and the Bow Valley College Symposium that's coming up.
Sure. We've had really, I have to say, a wonderful response from health
Glenda,
regulators and
sorry,
associations. Yeah.
Glenda, sorry to interrupt you. Your sound has gone really quiet here. Can you check your...
Is that better?
Yes, thank you.
Okay.
Continue.
I guess I had moved when I coughed. Thank you, Stephanie, for prompting me. We've had an exceptional response from healthcare regulators, professional associations, all recognizing the value of relational practice. It's more than just task-based when you're working in professions, caring professions like nursing and social work, et cetera. And so with that, the question is about making the education mandatory. We would like to see that happen, and that is one of our aims for the future. That, of course, is no small feat in a large mammoth system like we have across Alberta and then across the country. We are working in other jurisdictions as well. So currently, what we are saying with the education is that it is highly recommended to enhance your practice as a health or social care provider. We are working, as I said, for the future to have health caregiver-centered care as a central competency within all health social provider professions. Our aim, I'll say, is in 10 years' time, we want folks sitting around a boardroom table with a puzzled expression on their face saying, what do you mean there was a time when we didn't partner with family caregivers? That's the shift we want to see in the system, where people are embracing a new way of providing care and being inclusive of family caregivers who we've shown today are doing so much in community.
And we have to remember that what the trainees from these education institutions don't just work in the healthcare sector. It's so important to engage all the institutions because many of the people who graduate from these institutions go work in the community. They go work in the social sector. So it's not just about training for the purposes of working in healthcare. We want all care providers to be trained. So we want all these institutions to train their students before they graduate, minimum with the foundational, and more so if they expect them to do, depending upon the kind of work they're going to do, is offer them more advanced education.
Mm-hmm. Thank you, Ginger. She's already sent the information along, and we would be happy to provide presentations like this to other groups as well. So please do reach out to us. On the slide, you will see our emails reflected, and you'll get that in the post-webinar communication as well. It is about sharing the word and spreading the word. So today, after we log off this webinar, we're going to be looking to you, all of those who've joined us today. Talk to your colleagues, spread the word about the educational resources and the opportunity to join us in changing culture of care in Alberta.
May I ask, what does ASCHA stand for, Ginger? And Guy, what does RMWB stand for, if you don't mind either putting it in the text or just letting us know so we can follow up with you on those?
Alberta Seniors and Community Housing Association.
Wonderful. Thank you. Thank you. And yes, we are very interested in working with housing because many of their people that we care for have special housing or have needs that's beyond housing, but they're housed in different settings for that reason. So their staff also. So we are going to congregate facilities like supportive living and assisted care, etc., saying train your staff because while they are caring for to whatever extent they can, they often depend on family caregivers. And it's like somebody explained it to me, it's like a stool, three-legged stool. If you want that stool to stay balanced, one leg is, of course, the care recipient. The other is you as the care provider, no matter where you are in the housing scheme or in any setting or service. And the third is the family caregiver. So yes, please. Thank you. And thank you, Guy. So we would love to follow up with municipalities. I do want to say, as far as the question on policy is concerned, we are in the infancy stage of policies. It's taken us this long to get here. This has been a very, very big ship to turn. We had success with the new Continuing Care Act, which actually in its regulation now asks for home care staff to identify, so recognize family caregivers. Now, this is what would you say, Glenda, paradigm shift?
Yes, a paradigm shift.
Thank you. So where actually for the first time you have a regulation saying you got to identify family caregivers here in our country. So perhaps I shouldn't say in our country, in Alberta for sure, because there have been some other provinces who have attempted this previously. And then it expects them to assess their needs and support them. So now when you have it in regulation, we can expect policies to come forward. But we don't need legislation and we do not need regulations to create policies. We want all organizations to have some kind of policy that does simple things like promote these 6 petals in their policy, which has the expectation wherever you're working, if family caregivers are engaged, please, they should take the effort, make the effort to recognize them, and then so on and so forth.
Great conversation today, and I just want to thank you all again for joining us. I see we're nearly at the top of the hour here. I think we've been able to address most of the questions in the chat. Please do reach out to us. We are happy to connect with you for further discussion or to provide, as I said, a presentation for your organization. And so
yes, and Guy made just a very important point. So Guy, as we have asked, and Shauna McGann's online, she's doing a lot of work in this area, helping identify our family caregivers in the healthcare system. We are recognizing those who don't have family caregivers, you know, who may require a different approach. So thank you for raising that, Guy. And thank you all. You're all champions. And please help us. This is work none of us can do by ourselves.
Stephanie's also put a link in the chat for a survey. So really appreciate if you could provide your comments on the presentation today, and that's helps us grow